Hi, my name is Melanie Collins. I'm a home child care provider. I'm also a nurse, but I'm a small business owner now. Live in Falmouth, Maine, and I am struggling with health insurance and covering myself and my family with health insurance.
So Dan Danner, the president of the NFIB, they represent small business owners. He's out there speaking for folks like you and saying that you don't favor the option of a public plan because it might crowd out the private insurance industries. What is your take on that?
I think that's ridiculous. I would really like to have a public option for my health insurance. If not, in fact, having a whole public, all of the public have public insurance. So everyone having access to public insurance would be the best plan, I think. And so short of a national system or a state system that covers everyone, so everyone has an option, to have at least something that I can choose versus having private insurance would be tremendously helpful for me, and much cost savings, and I think a very valuable thing for everyone. Save business tons of money. Small businesses and big businesses too.
So you would be in support of strong government oversight of the insurance industries and the providers?
Absolutely.
Transparency.
Absolutely, we need a strong, the very least of what we need at this point in time is to have strong regulations on the insurance industry. At the very least, this is what we need. If we're going to even allow them to still exist in this country, the profit motive is not working for us. It's not necessary in a system that is about taking care of people's health. We don't want profit in that. It's a very damaging thing. What we want is to have the motive be to have people be healthy, not to put money in people's pockets. So we need transparency in that. What is that? That means we want to know what these insurance companies are making for profits. We want to know how they're spending their money. It should be public information. How can we choose whether or not they're doing a good job if we don't know what their statistics are? And it's all secret. That's silly to do that way. We can't. It's not a free market. It's not something that if we can't see what we're buying, we don't even get the choice to buy it or not. It's health insurance. It's something that we all should have the right to have, and we're not getting that choice. It's not a choice. We have either none, no ability to get it, or we have the one option, which is if we are lucky enough to have an employer that gives it to us or an employer that can offer it, we have one thing to offer, and it's either can I afford it or not. That's our choice. It's not a market that we are free to compare and contrast, especially when we don't have the information.
Tell me a little bit about your small business.
I run a home child care business in my home. That's what that means. Take care of usually 4 children at a time. Everybody wants to know that. And I love it. I wouldn't do anything else. I used to work as a nurse, and I left that because of poor staffing and dangerous conditions. I wanted to be able to be in business for myself and really take care of people, which I didn't feel like I could do in the hospital setting. And I totally love it. I take care of babies from 6 weeks old on up to as long as they want to stay. They usually leave when they go to preschool, and I do have returnees on snow days. I have children that still come back to me after 10, 11 years on snow days. They always want to come to my house because it's fun, and I love it.